This podcast is for educational purposes only, does not constitute legal advice, and does not create an attorney-client relationship. If you need legal assistance about a legal problem, contact an attorney.
Welcome back to Know Your Regulator, the podcast that inspires you to engage. I am your host, Simone Murphy. In today's episode, we are exploring a personal and powerful story of redemption, resilience, and regulation. We are honored to have our guest, Dr. Brett Cordes, with us. Dr. Cordes is a practicing physician, a recovery advocate, and someone who's been through that full arc of licensure, suspension, and reinstatement. We'll be diving into exactly what healthcare professionals face when they're struggling with addiction, burnout, and navigating that regulatory system. Dr. Cordes, thank you so much for joining me.
I'm glad to be here. Thanks for having me.
Absolutely. So let's start at the beginning. Can you talk to us about your background? Walk us through your early years in medicine and maybe when you began to notice that something wasn't quite right.
Sure. Well, I was we'll start way back at the beginning. I was born and raised in Baton Rouge, Louisiana, and went to high school and college here in Baton Rouge. I went to LSU and then went to LSU School of Medicine in New Orleans for med school and matched at Baylor College of Medicine in Houston. So that's how I ended up in Texas. But residency training lasted from 2005 through 2009, and I jumped on with a private practice inside the Texas Medical Center. In fact, we did a couple of rotations with this practice during residency, but I didn't have to go far, is my point. We lived in a suburb south of Houston, so we didn't have to move or anything. So it was a perfect fit, really. So I started practicing in August of 2009. It was phenomenal. I absolutely loved it. It was everything. It was really everything that I had dreamed or thought it could be. Because you have to remember, by this time I'm 32 years old, and I'm about to draw my first paycheck ever in my entire life, like real paycheck. You know, I mean, I cut grass when I was in high school and college and for money. But anyway, so that's a long time to go before you're, really entering the real world as a functioning adult.
Yeah.
But another thing is that I had been, working toward this goal pretty much my entire life. Now, when I started college, I did not know what I wanted to be. I thought, honestly, I really had no idea. So my major is in history, just because I enjoyed history. But it wasn't until I got sick. I got non-Hodgkin's lymphoma, cancer of the lymph nodes, during my freshman year of college. So that skewed my course to wanting to go to medical school and become a doctor. So since that time period, everything was working toward, becoming a practicing physician. So, that's 13 years of work with one goal in mind. And I'm finally made it. 2009, I'm finally here. I'm done with all the training. I'm done with all the education. And it was a great feeling. And so I would say my first 5 years in practice was perfect. I mean, absolutely phenomenal. My wife and I had 2 young kids that we were raising. Again, I lived in a suburb south of Houston. Life was grand. We were involved in our church community. We were involved in all kind of kids sports, and it was just, everything was going well. Let me put it that way. And so you asked when I first noticed something. It was probably around 2014, maybe 2015, when I started to feel bored. I have since kind of realized that really what I was experiencing was a lack of fulfillment. But at the time, it felt like boredom.
Yeah.
Because I had been climbing this mountain my whole life. I finally get there. And instead of being able to relax and live in the present moment and enjoy life, the only thing I could think of was, looking around for the next challenge. What's my next challenge? What's the next thing I can do to accomplish or whatnot? Because I was so used to that. And without that, I just felt like I was bored. I needed something extra. And so that feeling kind of grew into a low level anxiety. But that was how things started to go askew, so to speak.
Gotcha. Yeah. No, it sounds like you've got the picture perfect life that you've been working towards. And then it's kind of, I can see how you might have that, unfulfilled feeling going forward. You kind of get there and it's like, okay, what's next? What do I do next? And keep going and building upon that. Now that you've kind of come out on the other side, are there any warning signs, in hindsight that you may have noticed, or any like stressors, any triggers that you can think of that maybe you didn't notice then, but you would see now?
Yeah, I mean, again, the boredom thing is a pretty early sign.
Yeah.
Not I don't know anyone who would tie that feeling of boredom to burnout or an impending substance abuse issue, but it certainly was for me. And in terms of some psychological issues, there are definitely some warning signs. One is that I'll call it a character defect of mine, but I'm going to mention it because many physicians have this issue, which is I seem to kind of garnish all of my self-worth through my job, through
Mhm.
accomplishments. And so I needed some sort of external validation in order to feel worthy, so to
Yeah.
speak. And so when I stopped achieving goals and stopped being rewarded and stopped having these accomplishments and plaques and awards and whatnot, when those stopped, um, my self-worth kind of dropped a little bit. And again, this is I don't want to get too far into the weeds with the psychology of it, but
Right. But that
depending
makes
on external
sense.
validation is a setup for substance abuse or burnout.
Yeah, and I mean, I'm sure that that's seen a lot in the healthcare profession, I mean, there's a lot of people you care genuinely about your patients, but you're also trying to advance your career and advance medicine as a whole. And so you're looking for those accolades and those certificates and recognition. And I'm sure it makes sense what you said, that stops coming in and you kind of start feeling, like a lower self-worth or a lower self-esteem. We both know that physician burnout is a huge growing concern. Can you talk about what burnout really looks like, especially when it becomes dangerous? And just like we kind of mentioned a moment ago, how can colleagues or organizations, or even, the healthcare professional themselves, recognize that or catch it early?
Yeah, and so again, I won't even include boredom as a warning sign because that's hard to detect externally, from someone
Hmm.
else. But I kind of call it the grumpy old man syndrome. So irritability is probably the single most common issue that people have.
Yeah.
You just are in general irritable, both at work and at home. Not angry and not overtly frustrated, just kind of a low level of irritability is a very early sign. But then that can turn into having a shortened temper, um, some anger outbursts, and that generally starts at the office or within the professional realm of things. And it starts to get, it's starting to come off the rails a little bit when those symptoms leak over into your personal life. So now instead of getting frustrated at work because you have to talk to an insurance company, you're getting frustrated with, your kid for spilling milk, or, your personal life begins to become affected. So irritability, anger, frustration, shortened temper, and depression. You can also have, overt psychological diagnoses like anxiety and depression.
Yeah.
Those are also issues. And so it's not uncommon for physicians or healthcare providers, to seek professional help for anxiety or depression. So that would be another warning sign, so to speak. But again, that's also an obstacle toward getting help for burnout and for anxiety and depression. Physicians don't feel comfortable asking for help. We don't feel comfortable going to a psychiatrist and being prescribed an actual medication because we're afraid at some point that's going to backfire on us with the medical board or if patients find out. And so that's a concern that many of us have.
Yeah, no, and that's sad because you guys should be able to get the help that you need just as much as everybody else, you know?
Yeah.
What are some strategies that maybe you've seen or maybe that you would recommend for physicians or healthcare professionals when they're trying to manage their stress or trying to manage that burnout before it becomes overwhelming?
Yeah, well, we can talk about how to, stress management tools in terms of what causes burnout. So, there's five or six causes of burnout, but one of the big ones is, well, generally the work volume becomes so much that you're having to take things home, you're having to stay late at the office, you're having to come in on the weekends.
Yeah.
So the actual volume of work with the paperwork and the computer work that we need to do with electronic medical records that is being mandated these days from the insurance companies to get paid.
Hmm.
It takes a crew of six workers in the office to see a patient that comes in just to have earwax removed. So when that's the case, the paperwork multiplies and our work multiplies.
Absolutely.
And before long, you realize that you're doing more non-clinical work than you are seeing patients, which is no fun,
Yeah.
frankly. So the volume of work being excessive is one cause. Another cause is what we call a loss of autonomy. So, again, I spent 13 years training for this. I've spent another 5, 6 years in private practice. I feel like I'm an expert in my field, yet I'm having to argue with someone at the insurance company as to why this patient needs this medication or this imaging study or whatnot. So you get to a place where you don't even feel like you're the one calling the shots with your
Right.
own practice. Um, that's very frustrating to have
Absolutely.
to deal with. And so, and then coupled with just the electronic medical record constantly new coding coming in, there's just a lot of non-clinical work demands that just pile up, and it just takes the enjoyment out of it. At least it did for me.
No, I can absolutely see how you went to school to be a doctor. You didn't go to school to be an admin. You didn't go to do paperwork all day. So yeah, I can absolutely see and just the constant changing of regulations and rules and what's expected of physicians on paper, it is constantly changing, and I'm sure that that's difficult to keep up with and just kind of you've got to keep your head on a swivel, and that can absolutely burn someone out very quickly.
Yeah. Let me just say one
Yeah.
last cause, and I don't really consider this a separate cause per se of burnout, but um, the excessive work and the loss of autonomy that leads inevitably to what is called a moral injury, which in essence is when you as a physician have to start compromising what you feel is best for your patient in order to get a treatment done or performed. Again, so you're arguing with the insurance company for this or that, and let's say they don't let you get this imaging study or prescribe this medication. Now you're having to do something that or prescribe something that you wouldn't ordinarily do, and that's when some kind of hopelessness starts to leak in, and you start thinking to yourself, why am I even doing? I came in here to treat patients. I started this because I want to make patients better and foster a relationship with them. And now I'm not even able to do what I think is best. And so when that thought starts to enter your head, you are you're neck deep in burnout at that point, generally speaking.
Yeah, that's really good for, anyone who's having to prescribe or fight on their patient's behalf to know, because that is something that, I mean, it's all over the internet. I see a ton of TikTok videos of doctors, on the phone with insurance companies, who are, I think they're in a peer-to-peer, but the doctor who is, trying to give them information won't even reveal their name or their profession or their, expertise. And so I can see how it's extremely frustrating for physicians to get, the proper care for their patients and to even fight for that care. I can definitely see how that would be super frustrating.
Our nature is, not only do we not ask for help, but we're not big complainers.
Right.
Physicians in general, and most professionals. I'm saying physicians, but this pertains to other professions as well. But we're just not big complainers. So we let things pile up and pile up and pile up internally. So not only are we not asking for help, but we're not even complaining or venting. We don't generally have an outlet that we feel comfortable to do that with, because, let's be honest, the general public doesn't want to hear doctors complaining, because the perception is that doctors are rich and wealthy and
Right.
and everything is perfect in their lives and everything. And so the last thing that the general public wants is their doctors complaining about not being paid enough or having to work too much, And so that kind of leads to some isolation, so to speak. So again, it's kind of burnout is a perfect storm of issues coming from every direction, it seems like.
Yeah, that's a
Anyway,
great way to put it. It is a perfect storm of a bunch of moving parts and, none of them good, but yeah, no, it's a lot of different things happening at one time that kind of the end result is the burnout.
yeah, yep,
So at some point, you kind of got caught up in the burnout and the overwhelm, which led to addiction, and that addiction led to some regulatory consequences. Can you talk to us about what that process was like when you began interacting with the Texas Medical Board?
sure. Yes, and so this was in 2019.
Mhm. So quite a
Uh,
while after this is 10 years after you've, gotten your medical license, right?
right. Yes, this is my 10th year of practice. You're correct. And so I became a blip on the radar of the Texas Medical Board in 2019. And so, I'll just say my deal in general, as an overall broad, my dealings with the Texas Medical Board was extremely negative.
Hmm.
Um, and, I realized that the Texas Medical Board does not exist to help Dr. Cordes. In fact, if anything, they exist to protect the public from me, particularly if I was active in my addiction. And so I realize that that's the case. I realize that they're not my friend.
Hmm.
I realize that sometimes that they can't, they can be mean or short tempered or whatnot. But, two things can be true at the same time. They can protect the public, and they can also treat physicians with respect. So I got involved with the Texas Medical Board in May of 2019, and you get a letter in the mail saying, we have come to learn this and this and that, and they want you to write a letter, kind of defending yourself.
Hmm.
And then they give you a date. I'm going to go through the process here as if people have never dealt with it, just
Sure.
so they know.
Yeah.
But they give you a date that you're going to have a preliminary hearing. In my case, that was the following February. So that's 9 months after the incident.
Yeah.
After they first sent me that letter. Now, sometimes they'll allow you to practice during that interim of time, and sometimes they don't. It kind of depends on what the offense is. They did not preclude me from practicing, but you've got this thing on your mind for 9 months, knowing that you're going to be meeting with the medical board and have no idea what the possible consequences are. Is it going to be a slap on the wrist? Are they going to suspend my medical license for 30 days, 90 days, a year, 5 years? Are they going to revoke my medical license? None of that stuff is known. At least I didn't know it.
Yeah.
And so there's a lot of stress, an enormous amount of stress involved once you become tangled with the Texas Medical Board. And my malpractice insurance company did provide me with a list of attorneys that I could contact to help me through the process. So that was a big help.
Yeah.
She was able to answer a lot of those questions that I didn't know the answers to early on,
Yeah.
and that kind of helped with the anxiety regarding the whole situation. But when it came time to actually go to the hearing and present my case, and I'm just going to speak for myself here, and you can speak to this too. I'll be curious to see what your perspective is. But I felt that because I walked into this hearing with an attorney, it created somewhat of an adversarial relationship
Hmm.
in the room with the Texas Medical Board attorney on one side and myself on the other. That was just the way it felt to me.
Yeah.
And so when it came to presenting evidence on both sides, it's basically like a little mini trial. They're trying to show that I was unsafe to practice medicine, and I was trying to show that that wasn't the case.
Right.
It doesn't, the right thing and doing the right thing is not really the ultimate goal. At least that's what it felt like to me. To me, it felt like the Texas Medical Board attorney wanted to win, and
Yeah.
they wanted me to lose. And that perception continued for the entirety of my dealings with the Texas Medical Board.
Hmm.
And so I'd be curious to get your take on whether you think, or if having an attorney creates this adversarial relationship between the medical board and a physician.
I would say to that, it really depends on who the staff attorney would be or who the prosecutor from the board would be. I've seen, obviously they can't be too unfair, too obviously unfair, too obviously harsh. But I can absolutely see both scenarios, right? I think both things there could be true, that there are definitely going to be some prosecutors and some staff attorneys who are just out there kind of on a power trip and who are really looking to bring the hammer down on someone who necessarily doesn't deserve that type of sanction or that type of reprimand. Um, and then I think that there are attorneys who have really good working relationships with those staff attorneys who can maybe change the staff attorney's perspective or with a certain argument get them to see something different. But I will say that TMB, the Texas Medical Board, is harsh. They can be more harsh than some of the other boards. I'm not an attorney, so I'm not in the courtroom fighting, but just based on, some of the things that I've seen from our Bertolino firm, that they are one of the harsher boards. And I would say either way, I would get an attorney because you just don't want to answer, like you said, answer a question wrong. Sometimes you get that letter and you're so eager to sort of prove your innocence or prove or give them, give them what they're looking for because you don't feel like you have anything to hide. And that can come back and really bite you. An attorney can look over that and say, hey, you don't need to include those records, Oh, maybe this wasn't entered the correct way, but they don't need to see that because that's not what they're requesting. And so you've saved yourself a separate case, but that's what I would say is that a good attorney will be able to recognize if they are kind of bringing the hammer down on something that doesn't need to be, um, you don't need to be reprimanded so harshly for. I would just say to that, two things can be true.
Yeah. And I will second what you were saying. It's vital to have an attorney or someone with previous experience with the medical board in terms of, because I was exactly as you described, I was excited to cooperate with them. And I was excited in the beginning to show them everything and give them everything possible because I was thinking, more information can only be helpful to me because I don't feel like I'm guilty of what they're accusing me of. And so if I were to give a piece of advice to someone who has an impending meeting with the Texas Medical Board, it would be to get an attorney or or to speak with someone who has experience in the process, and just to realize from the very beginning that the Texas Medical Board is not your friend. They're not there to help you in this circumstance. And you really do yourself a disservice if you don't realize that early on. Because like you said, things that you do or not do, or things that you say can really come back and bite you.
Yeah, they can just be so misconstrued by the board, and you are left going, wait, that's not what I wanted you to think, or that's not what I meant. So, well, now that you've come out on the other side, Dr. Cordes, what does life look like today for you and your practice?
Yeah. And I'll say, so I became, my relationship with the medical board began in May of 2019.
Hmm.
They suspended my license for 1 year. However, very unfortunately, this was when COVID occurred as well.
Oh
And
no.
so COVID created some delay in things. The Texas Medical Board did not proceed efficiently, in my opinion. So that 1 year suspension, or what was supposed to be a 1 year suspension, turned into 3.5 years.
Oh my gosh.
And by this time, I was not working, nor could I find work with
Yeah.
a suspended medical license. And so it wasn't until 2023 that I was able to go back to work. And late 2022 is when my suspension was finally lifted in Texas. And so by that time, I had moved to Louisiana. I'm from Louisiana, like I was saying. And so I had to, declare my issues with the Louisiana Medical Board,
Hmm.
and the two kind of talked with each other. And I was excited to kind of start fresh. I did my time, so to speak, in
Right.
Texas. I knew that Texas Medical Board had a reputation for being harsh, so I just assumed that Louisiana would essentially take what Texas is saying. Hey, he's served his time. We've listed his suspension. He's now ready and safe to practice medicine again. But unfortunately, that did not happen. And Louisiana Medical Board put me on probation. And so when I worked for a year in Louisiana under probation, it created a lot of issues in terms of getting on insurance companies' contracts,
Yeah.
and getting privileges at certain hospitals, and or surgery centers. A lot of times they have bylaws where they won't license someone or get you a contract if your license is suspended or if you're on probation.
Hmm.
And so it created a lot of issues for me, and that only made the burnout even worse. I thought going back to work was going to fix all my problems, at least the anxiety and the depression that had formed, and it did. Going back to work did help that, but
Hmm.
because of the continued issues, I realized within 6 weeks that I really did not. The passion that I had for clinical medicine wasn't there anymore.
Yeah.
I loved my patients. I loved fostering relationships with patients. But after my 1 year contract was up, uh, the venture capital firm that purchased the practice that I was working for did not renew my contract because, again, they just took one look at the probation and made that
Yeah.
decision. And so that's when I decided to. Actually, I had decided prior to that, but that's when I decided to retire, so to speak, from clinical medicine
Hmm.
and start working with other physicians who are going through burnout,
Yeah.
especially if they have consequences with the medical board or if they have any issues with substance abuse, which is very common. But it was nice to kind of feel passionate about my professional life again.
Yeah.
And so that's what I'm doing now.
That's awesome. That's great. I mean, gosh, how frustrating that must have been to wait and the COVID delays. And then I'm glad that you, I'm glad that you are kind of early on and going back to medicine were like, nope, this is not for me. I'm gonna do something else. I think that you really did yourself a good service there and kind of some good self-care.
Yeah.
So you did, you mentioned, a piece of advice earlier for physicians or healthcare workers. Anything else that you would have to say to a physician or healthcare worker who's, maybe facing burnout or addiction even?
Yeah. And I'll start out by saying that, there's not a lot of options.
Yeah.
Let's say that you're a doctor or a nurse or a healthcare worker who's experiencing burnout, and you've come to realize that. And again, that doesn't usually happen until you're late in the process.
Right.
And you've decided that you need to get help for anxiety or depression that you're having, all the frustration and irritability. I've got an issue with the medical board. I've been drinking a lot lately. These are all issues that could pop up, and there isn't any one place to go for that. Now, I would recommend seeing a psychiatrist for formal diagnoses like anxiety or depression. But again, doctors aren't real excited about doing that because the perception is that they could backfire. That could backfire for them. There are physicians who are doing what I do, which is to treat burnout via Zoom, and essentially, my job is to change the perception and the perspective of doctors and change the way that they feel about reality, as opposed to trying to change their life circumstance, because I can't do that, you know.
Right.
And so, I'll just tell the audience that you can find me at theburnoutodoc.com. And then my website has lots of resources about symptoms of burnout and treatment options and whatnot. But that would be the way to find me specifically.
Perfect.
And I think heading into the future, there are going to be more options. There are going to be more people treating burnout. In fact, I think that a mandate will probably be coming within the next 3 to 5 years for large hospital conglomerations they're going to be required to have someone on staff to both identify when burnout is occurring and treat it. So hopefully more options are coming in the future.
Yeah, hope so. Hope so. I know it's something that has been going on for a while and that just keeps increasing. So yeah, hopefully we see something change here in the next couple years. Well, Dr.
Yeah.
Cordes, thank you very much for joining me today. Thanks for sharing your story with us and hopefully inspiring some other physicians to either recognize burnout or maybe they can recognize it, in someone else, but just kind of help everybody take care of each other.
Yeah. Thank you so much for having me.
To our listeners, if you or someone you know is facing addiction, burnout, or a licensing issue, please remember that you're not alone. There are many resources to help. For more resources to prevent burnout, check Dr. Cordes' physician coaching resources linked in our description below. Don't forget to subscribe, like, and share Know Your Regulator for more conversations that protect your license and empower your career. Until next time, stay inspired and continue engaging with your regulatory agency.
Know Your Regulator, the podcast that inspires you to engage.